So today I'm going to be talking to you guys about some upcoming Medi-Cal changes as they relate to Californians without satisfactory immigration status. So have you guys heard of HR 1? The big beautiful bill. So that's what we're going to be talking about today. We in our organization here, we just refer to it as unsatisfactory immigration status. All right. So we are going to be providing this presentation to you, as Sarah said, but it's on multiple screens all around you, so if you can't see it very well. But I just wanted to start off by giving you guys a timeline of some of the changes that have happened in the past and then what we'll see going forward. So as of June 30th last year, the public health emergency flexibilities ended. So some of those flexibilities where individuals didn't have to turn in their renewal packet, where certain waivers didn't apply for income, for property, things like that. All of that ended June 30th of last year. So what we saw take place starting January 1st of this year is that the asset checks for seniors and people with disabilities, that changed. So the asset limit is now 130,000 for one person, and then you would add 65,000 for every person with a max of 10 persons. So this is really critical because when you think of assets as resources and dollars that you have in your checking account, savings account. So that's one of the things that changed January 1st. Also, one of the most critical thing that changed was the UIS, so unsatisfactory immigration status, enrollment freeze. So what this says is that some adults will no longer be eligible to sign up for full coverage Medi-Cal based on their immigration status, which really hurts a lot of the population that lives here in our Inland Empire communities, Riverside and San Bernardino. With that, there are still people who would be eligible to full scope Medi-Cal regardless of their immigration status. So that would be children's ages 0 to 18, pregnant people for their whole pregnancy and then their postpartum period as well, and then former foster youth under the age of 26 who are in foster care on their 18th birthday. So with the full scope changes, essentially it's telling us that if an individual does not complete their Medi-Cal renewal packet after January 1st of this year, they may no longer be eligible because of their immigration status. And it's really unfortunate because in the healthcare business, we want everybody to have access to care. However, with the new laws that changed effective this year, it's making it a little bit challenging for individuals. On July 1st of this year, we will see that the dental coverage that is provided through Medi-Cal, that dental coverage will end. So unsatisfactory immigration status members or patients, depending on business, age 19 and up will stop getting full scope dental services as part of their Medi-Cal coverage. So in your work that you do with your communities, this is where we really want you guys to stress this information to families, because we don't want them to go to the dental office and then find out that the care that they received after July 1st is no longer covered. As we go into January of 2027, we'll also see that the work requirements will change. So adults ages 19 to 64 will need to work, volunteer, or go to school to keep their coverage, right? And some of you may be thinking, like, individuals at certain ages or depending on what's going on in their household, maybe can't work, may not have the skills or resources to find work in their field. But starting January 1st, that will change where there will be that work requirement. Also, what we'll see in 2027 is the 6-month eligibility check. So this is where adults ages 19 to 64 will have to renew their Medi-Cal eligibility twice a year. So are there any folks in the room who remember the MSR mid-year status report? Have you heard of that term before? I see a few hands. So that was essentially what individuals had to complete every 6 months to keep their Medi-Cal. So it was a single page sheet that would get mailed to the households, and the individuals have to check a box. Remember that? I hear some yeses. So they would check a box if their household stayed the same, or not check a box if nothing had changed. But if the individual reported, yes, I've moved, or yes, I've started a new job, then they'd have to provide new income verifications or verifications of that change. So that will be starting in 2027 as well, right? And then also retro coverage. So Medi-Cal will only pay for 1 month of past bills for adults 19 to 64 without children. So has anybody heard of the term retro benefits? All right, so that's essentially what this is. In the past, individuals were able to request that 3 months worth of billing was paid for, but now, excuse me, in 2027, that will be reduced to 1 month. Right. So it's pretty significant changes that are going to be occurring. All right. And then also in July 1st of 2027 will be monthly premiums. And so this is based on individuals' immigration status. Some members or patients will need to pay a small premium, estimated at $30 to keep their Medi-Cal coverage. And so this is something that's entirely new that Medi-Cal hasn't seen, where individuals will have those monthly premiums, right? So again, kind of recapping what we just talked about is that the retroactive coverage period will be reduced from 90 days to 30 days. Medi-Cal work requirements will start January 1st of 2027. There will also be changes to federal funding rules that may limit some immigrants, as certain coverage will no longer be fully supported. And then beginning in 2028, co-payments will be imposed. Oh, I'm sorry. You want to take your picture? We're emailing it. All right. So again, some key changes is that effective January 1st, Medi-Cal applicants 19 years and older without satisfactory immigration status will only qualify for restricted benefits. And so restricted benefits essentially means emergency room services only. Right now, individuals can go receive care for preventative care, but as of January 1st, it's restricted benefits means only Medi-Cal, only emergency room services. I talked a little bit before in the previous slide about the dental benefits. Again, those will no longer be provided to adult members 19 years or older, and then members under 19 years old pregnant will remain eligible to full scope Medi-Cal with dental. And so you may be asking what full scope Medi-Cal with dental with no dental covers. So members will still be eligible to medical care, specialty care, and mental health care, as well as family planning, maternity care, and emergency care, and then their vision, hearing aids, in-home care, and a few more additional services. So I do want to speak a little bit about the Medi-Cal renewal process for those who may not be familiar with it. And then we do have our county partners over here at the back table if you guys have additional specific questions about Medi-Cal renewals. But essentially, every year, a member has to complete a Medi-Cal renewal packet. Depending on the month that they initially applied is when they will have their renewal. So if I applied for Medi-Cal in March, then every March will be when I have to renew, right? So here in Riverside and San Bernardino counties, a Medi-Cal packet will be mailed to that member's home about 60 days before their renewal packet is due. Members have 60 days to fill out the packet and return to the county. Members have 60 days to return it and get it back to the county. It comes in a bright golden envelope to their home or the Golden State. So it comes in a bright, golden, recognizable envelope to their home. And so it's really critical that this isn't placed in the back pile of junk mail as it may get lost, because it's a long window that members have to get all of their verifications available to turn it back into the county. So members can submit their renewal packet in multiple ways. One of those ways is mailing that completed packet back to the county, or walking it into the county, submitting it via the Dropbox or an eligibility worker. But also online through benefitscal.com. Here at IEHP, the eligibility and outreach team, we do encourage members to create a benefitscal.com account. This is the fastest and easiest way to submit anything to the county, to turn in your verifications, or to connect with their worker. It's very important that the members submit their renewal and turn in all the rest requested verifications, because if they don't, they may lose their Medi-Cal eligibility. They may lose their favorite health plan of IEHP coverage, and they may potentially be reduced to restricted scope Medi-Cal benefits, right? So a part of the work that our team does here at IEHP is that if a member needs additional support with completing their packet, is that we will meet them at a DPSS office so that they can turn their stuff in. We will meet them at a Social Security office. Whatever is that need, we will go to them to ensure that they turn in their paperwork. In the work that you all do, we really want to stress upon, if you're working with members and clients, patients, is that you impress upon them that it's critical to sign the back page of their renewal, because if they don't sign it, it's not complete. If they're working, to turn in any pay stubs for that current month that's being requested, because oftentimes members think that they have done all these things and then they didn't turn in their verifications, and now the county has to request it. So then it becomes a delay. And so we don't want there to be any delays. So if we can communicate to our populations the importance of turning in their verifications timely, and like I said, we have a 60-day window, right? It seems like a long time until it comes the week of. So you guys all know about that, huh? All right. So for some guidance, I'll respond promptly to the renewal package from their prospective counties. If discontinued, members do have a 3-month post period. We call it, oh, Gary, where am I at? Cure period. There is a 3-month cure period that will allow the member to turn in that application without losing the status that they previously had. Meaning they had a full scope, or some individuals already have restricted scope benefits. However, they will have 3 months to get everything turned in timely. Members can keep track of their renewal by going to benefitscal.com. They will also see any notice that the county has sent to them in benefitscal.com. All right. But like I mentioned before, it's really important that all of the members respond timely to the request from the county. Members can also contact our IEHP eligibility and outreach team for assistance in submitting their renewal packet, and we will also guide them through all of the steps, answer any questions, because it's a lot of pages, right? How many of you have seen the Medi-Cal renewal packet before? It's a lot. It's several forests, right? And we need our forests. So we really want to make sure that members are reading everything in detail, so that they can make sure that they have all the critical information. But it is a lengthy packet. But that's why our team here at Eligibility and Outreach can support members through that process and answering any questions that are on that packet. So I did want to get a little bit into the work requirements that I spoke to earlier. As I mentioned, adults ages 19 to 64 will have to work, look for work, or participate in approved activities that start January 1st of 2027. So I know it's a little small, but I'm gonna summarize this for you. Members will have to do a few of the following things in order for it to be considered work. Is that they will have to earn at least $580 a month from working, right? Be a seasonal worker, which is someone who works during certain times of the year, and make an average of $580 a month over the last 6 months. Be in a job or training program that helps them to learn skills to get a job for at least 80 hours per month. Volunteer or do community service for at least 80 hours a month. These should be organized in something that the member can do, or to get proof, get a letter from said organization that they did participate in these activities. Work is also considered going to school at least half-time. This usually means taking at least 2 or 3 classes at their local college, community college, or university, or a trade school even. If they're in cosmetology school or barber school, those are also approved as well. Any of those things that I've mentioned before that are on the screen that total up to 80 hours per month and where they earn at least $580 a month will be a qualifying activity. But they're all, let me go back. Okay. There are also some qualifying exemptions as well to those work requirements that I just mentioned. So anybody that's 0 to 18, they don't have to meet work requirements. Older people, 65 and up, will not have to meet work requirements. Pregnant people, including those who are 1 year postpartum, parents with children ages 0 to 13, people with disabilities, serious health or mental health conditions, people who were released from jail or prison within the last 90 days, or individuals who are on Medicare Part A or Part B, an American Indian or an Alaskan Native, or our former foster youth who are under the age of 26. All right. So, how do you guys feel about this? Is this making you feel a little bit easier about your populations and the work requirements? Yes. Yes. Alrighty. So like I mentioned before about the old MSR mid-year status reports, so the new term we're using is 6-month eligibility checks. Those will start in January of 2027. Again, those are for individuals ages 19 to 64, but it's important to know that members may need to renew their Medi-Cal every 6 months, depending on what the outcomes are of what they say on their 6-month eligibility check. Yes, if something changed in their home. But who will continue with a 1-year renewal only? Those are individuals who are in a Medi-Cal program that is not under the Affordable Care Act new adult group, pregnant or postpartum individuals, Alaskan, Native, or American Indian, and then again, those former foster youth under the age of 26. So there are some exemptions, as you can see, in every category. I did want to provide to you guys the county contact information for our partners. We have a San Bernardino County. Their 877 number is their customer care center, their customer call center. And then the same thing for Riverside County. It's also their call center teams. So if you need any support, if you have any members that have questions about their Medi-Cal, if they want to speak directly to their worker, these are the numbers that they will call for that support at the county level. And it's not just for Medi-Cal. Whatever additional self-sufficiency programs, CalFresh, CalWorks, also Cash Aid, General Relief, or if they need EBT cards, replacement or issued, anything like that. So how can you collectively support our members is sharing the information that I've shared with you today. We do have some flyers on your table that provide an overview of what I've been speaking to as well, but advise members to keep their contact information current. You wouldn't believe how much mail we send out at the county level and an IEHP that we get back because we don't have that member's current contact information. We move, right? And you'll call your cell phone company, you'll call Verizon, you'll call Spectrum to do your address change. But you may not call your health plan or the county. So please, with the members that you're in contact with, make sure that we have their current contact information, address, but also their phone number. With our team, we send out text messages to the members to remind them of their renewals. And as part of our text messaging campaign, we get replies back. And they're like, this is not my phone number. I don't know who this person is, but that's all that we have on file. So if you can really make sure that you're sharing with individuals to update their contact information, also advise them to complete their renewal, right? You don't know that you lost it until you go to use it and don't have it, right? So it's really important to create that benefitscal.com account so that they will always know where they're at with their benefits. All right. Share these flyers with your members within your organization. We can also, my team, we can make some available to you. So if you want to put on your front counter, when you're doing resource tables as well, you can share information about these changes. And then also you can direct members to call us. We are more than happy to take their call to assist them in navigating through the renewal process because it can be very tedious and you could feel defeated when trying to go through it. Like we mentioned before, I am one of 2 managers here in Eligibility and Outreach, where we lead a team of 68 team members. And when I mentioned before that we support our members through renewal, we support them by doing outbound calls. So just about every month, we receive about 30,000 households to call between Riverside and San Bernardino County to educate them on the renewal process. This is the 3rd year that our team has helped members go through the renewal cycle. Some of them are familiar. They're like, we know you called me last year, you helped me, it was amazing, right? But sometimes when individuals apply for Medi-Cal, they don't know that they have to renew it every year. They think it's one and done and may forget that just that it's you have to renew every year just through living life, right? But that's what our team here is to continue to educate them on the renewal process, letting members know the documentation that is needed to make that renewal complete for the next year. And then also our team works with doing community-based events and engagement activities. We also work with our community engagement team. We have that team back here in the back. Waving, thank you so much. If you see an IEHP branded booth at any event in the community, it likely is our community engagement team. And they often invite the eligibility and outreach team so that we can be in the field answering questions as it relates to Medi-Cal renewal. Our team, we also are on site here where we have team members on site at least 3 days a week if a member walks in and want support, but we also provide support at our community wellness centers, the one in Riverside right near the Tyler Mall, and there's also one in Victorville. Right. So this is the information on how to contact the eligibility and outreach team. If you scan that QR code, it will take you to our IEHP Eligibility and Outreach public-facing website. And on this website, members can put in their name, phone number, email address, and if they need support, we will respond back to that email within, they can do an inquiry. We receive it as an email. Once we will receive their email, we will respond back to them and help them in any ways that they need help. So I do want to transition a little bit to Benefits Cal. Can I get a raise of hands if anybody can tell me if they know about Benefits Cal? Have you heard of it? Alrighty. So like I said before, what our team does is we rely on the use of Benefits Cal with our members creating these accounts, right? Not only does it help the member in the long run, it also helps us knowing that the member will always have access to their case information. So community-based organizations can apply and utilize Benefits Cal for their support within their organizations. So any nonprofit organization, a community center, hospitals, advocacy organizations, we really encourage you to apply and manage a CBO account with benefitscal.com because it lets you track the number of individuals who are applying for services at your level. So in the past, you may tell an individual, go to the county of San Bernardino, go apply for benefits, and you kind of send them on their way, but you never really know if they actually applied or if they're running into any barriers. However, with you being a nonprofit organization, if you set up a Benefits Cal account, you can help that individual apply for benefits and then track the progress of that account as the member navigates through that application process. So in Benefits Cal, community-based organization staff can either have a CBO manager account or a CBO assister account. So the CBO manager accounts are usually for leaders or people in charge at the CBO. Have the ability to oversee the work on the staff who are called CBO assisters. Are there any CBO assisters in the room? Yes, all right. Thank you. So you know what I'm talking about. You want to do the presentation for me? Okay. So who uses the CBO assister accounts are usually staff members who work for CBO managers. If you need a CBO assister account, then you can ask your manager to set one up for you. But what can a CBO account do? For both CBO managers and assisters, you can submit applications, upload documents, and generate reports as well. So I do have a brief clip that I want to share with you all about benefitscal.com. This information is pulled directly down from Benefits Cal YouTube website. And so it will give you a little bit more deeper dive of what a CBO can do with the Benefits Cal account. So I will go ahead and click play here. Okay, hold on. We're gonna pause and add our volume. Yes. So I've created a link at the bottom where it says benefitscal.com on the bottom left, and it will take you directly to this video. Okay.
Community-based organizations can do several things on behalf of clients within Benefits Cal. They can submit applications, upload documents, Community-based organizations can do several things on behalf of clients within BenefitsCal. They can submit applications, upload documents, check application statuses, view reports of activities, create referral campaigns, and create and manage staff accounts. There are two types of CBO accounts available on BenefitsCal: a CBO manager account and a CBO staff or assister account. Both managers and staff can use BenefitsCal to apply for benefits, upload documents, view reports on customer applications, and view and track referral campaigns. CBO managers can also create staff accounts, view staff applications, view reports for staff application, resume applications on behalf of staff, add and remove staff within their organization, and create referral campaigns. CBO manager accounts are usually for leaders or people in charge at the CBO. They can oversee the work of their staff, who are called CBO assisters. CBO assisters are usually staff members who work for CBO managers. If you need a CBO assister account, ask your CBO manager to make one for you. Now, let's get started with how to request a CBO manager account and log in. First, navigate to benefitscal.com. From the home page, click Login at the top right corner of the screen. This is the login screen. Here, users who already have an account can log in by entering their email and password and clicking the Login button. CBO assisters will need their managers to create an account for them and can't request an account through this process. If you're a CBO manager who does not have an account and would like to request one, click the Create an Account button under the Don't Have an Account section. Next, select the CBO Manager Account option from the menu and click Next to continue. To request access, complete all the required fields. For the county, select the county where you assist the most clients. It's possible that you work in more than one county, and that's okay. Just select one for the form. Check the box to accept the terms and conditions, then click Register to submit your access request. The access request is on its way to the county. The county will review the request for access, and it may take a few days. Once approved, the county will create your account and send an email with instructions to get started. Here's an example of the email you'll receive. The email includes your user ID as well as instructions and a link to complete your account registration process. Click the link to continue. Enter a password for your BenefitsCal account. The password must be at least 8 characters long, have at least one letter, one number, and one special character. It also can't include commonly used words like password or character patterns like QWERTY123. Once you selected your password, re-enter it in the Confirm Password text box and make sure it matches the password you entered above. Then, click Save to finish creating your account. Congratulations, you've successfully created a CBO Manager account. After creating your account, log into BenefitsCal using your user ID and the password that was just created. Then click Log In. Enter 3 security challenge questions to help you recover your password in the future. Select a security question from the drop-down menu, then type the answer in the boxes provided. Then click Save. Finally, click I accept to accept the BenefitsCal terms of use and log into your account. Next, we'll cover a general overview of the CBO dashboard. Here's the BenefitsCal dashboard for CBO and staff. At the top of the screen are menus for various topics. BenefitsCal is also available in many different languages, accessible from the drop-down menu. This is the dashboard for CBO managers. On the left is information about applications. Click the View Staff Applications button to see staff applications and the status of applications you submitted by status. Click the New Application button to start a new application. On the right is access to the Document Center, reports, staff accounts, referral campaigns, and help resources. Now, let's go over how to create and manage staff accounts. From the dashboard, locate the Staff Management card and click on Manage Staff. Here, CBO managers can add new staff member accounts by clicking Add Staff at the top of the screen. Fill out the required boxes with the staff's information. Then click Create a Sister Account to continue. Great! The account is created and Benefits Cal sends an email to the staff's email address to complete their account setup. The staff management screen allows CBO managers to view more information about the staff accounts. Click View next to a staff account to bring up the staff details screen. Here, CBO managers control if the account is active or inactive and shows more details about the staff account. If the account has a lock next to it, that means it is inactive. Now, let's look at how to view applications submitted by staff at your organization. Starting on the CBO dashboard, click the View Staff Applications button under the Staff Applications section.
Alrighty. So I wanted to give you guys a brief overview into Benefits Cal. Now that you guys have seen this preview, how many of you will be going back to set up a Benefits Cal account? I got a few hands, or for show. Anybody else? It is definitely beneficial for you to have a CBO manager account or CBO assister account. The video is 18 minutes long, but we didn't want to play the entire thing, but it does go into a little bit more detail about the different reporting that's also available to you all. But again, I highly recommend this as a resource for you and your organizations so that you can help your population navigate through the process and even see if there's been any delays. Alrighty. So does anybody who uses benefitscal.com have any tips for those of us in the room who will be setting up pages? I heard it's really easy.
Super convenient. You can do like the applications really quick. It's not confusing at all.
All right, and we have our county, San Bernardino, with some feedback.
So not a CBO, but I do have our contact information here from our outreach wing. If you guys are having any technical difficulties along the way getting approved for that CBO account, we can help along the way as well. If you need more information regarding the programs and how it looks like, we can provide presentations for that as well. So I know I shared that information with a few of you, but for those of you who haven't approached the table yet, I know there'll be a moment later on today. We are available.
Thank you very much. Well, that is all the time that I have.